Here are the beauty of the sunrise on the majestic peaks of the Himalayas. It is Nepal. Millions of poor people who live in these beautiful remote areas suffer from a lack of services and basic medical care, resulting in many diseases, the most prominent of which are cataracts, which are the main cause of blindness. According to reports, 43 million people are living with blindness globally, and cataracts are the leading cause. Thanks to an extraordinary man who has changed lives in many poor communities around the world by treating cataracts inexpensively and effectively. He makes rounds in Nepal's and other developing countries' remote areas, providing high-quality eye care through outreach camps and by performing free surgical operations.
It was about that time when I came back as a very young ophthalmologist. I was totally frustrated with the results that the patients were moving around. Patients were not happy. If they had surgery in one eye, they would never come back for the other eye. So I started thinking that the modern precision cataract surgery available in New York, London, why can't we have it in this part of the world?
Dr. Ruit has always dreamt of treating cataracts through developing a surgical technique that is simple and cheap and can be done for many people in a limited time. So has managed to develop a new affordable lens that can be implanted inside the eye to perform a cataract surgical operation through small incisions in less than 5 minutes. Dr. Ruit formulated a unique payment system where only financially capable people can pay for treatment, and by their money, treatment costs are subsidized for others who cannot afford the treatment. This has benefited the poor across Nepal, enabling them to avail quality eye care.
Many people thought that it was a mad idea, but we continued stuck up, despite the challenges, and we were able to finally come out with a very good surgical technique, which was extremely well quality assured and could be done in masses at very low cost. And we started manufacturing lenses in this part of here in Tilganga, and the lenses, the price of the lens came down from $200 to less than $3.
In 1992, Dr. Ruit launched the Tilganga Institute of Ophthalmology. By the end of December 2022, Tilganga Institute and its outreach camps were able to serve more than 7 million patients, manufacture more than 6 million intraocular lenses, transplant 11,790 corneas, screen 63,525 people, cure 6,694 people from cataract blindness, train 20,720 students, have 279 research fellows.
This time of the year, I would think it's about 1,100 outpatients. 1,100 patients come in the outpatients just for the checkup, and in a day we do about 110, 115 surgeries every day. This is only in Tilganga, but Tilganga not only works in Kathmandu. Tilganga has got another hospital in Hetauda, another hospital in Bhaktapur, and we have got different smaller units. We call them community eye centers, and we have 18 community eye centers in different districts.
Dr. Ruit and his team regularly visit remote and impoverished parts of Nepal and some other developing countries to provide treatment for poor people who are deprived of health services and unable to afford travel and treatment. The eye camp setup will be announced weeks earlier. Mrs. Murati Parsi is a blind woman who had lots of difficulties because of her cataracts blindness. She used to live in a house owned by her daughter, who had 3 children of her own to look after. Murathi was unable to work. Even though she was trying hard to help in the fields, she would fall down most of the time. She felt she was burdening her own family with her case, as she could not even prepare and eat the food by herself. Due to this, Murathi decided to reach Dr. Ruit's eye camp, hoping to restore her eyesight. People will arrive from poor villages to his eye camp on foot. Blind people with their families will climb mountains and go through rough terrain for days just to see Dr. Ruit. Dr. Ruit himself with his team also travel on a hard journey, driving through steep mountainsides and jungles for hours and days to reach the camp.
It's very important for somebody like us to go to these areas, and mainly because you understand the problem at very close, and second is it's still part of trying to deliver high quality eye care and make it accessible to these people. And also that brings in inspiration for the younger service providers, doctors and nurses to do this. You know, it's not easy, but in many parts of the world, geography is like in Nepal, scattered, and people can't come to you, so you have to get close to the people who really need it.
After the surgical operation, patients and their families will be under tension. Emotions will provoke questions about the surgical operation's success and the new life waiting for them after getting back their eyesight. Beside exporting his affordable lenses to the developing countries and changing the lives of thousands of poor people by providing feasible treatment, Dr. Ruit has also been exporting his welfare work through training doctors around the world by creating a generation of adequately skillful and knowledgeable doctors who have the potential to serve with cultivating a culture of service for humanity.
I feel really humbled to be able to see all of the patients who've come in here and appreciating how far they've travelled, as well as what sacrifices they've made to be here. The experience has been really interesting to see, I guess, the patient flow. So from the initial screening process, going through to peri-op, as well as like in the theatres. And I feel really grateful to be able to see the work that the doctors do, because they're working all day, like so many hours, and they're getting through so many patients, and then being able to see them afterwards as well. And being able to see how grateful they are, makes it really appreciative of the whole experience.
I used to have lots of problems, but after my eyes were opened, I could roam freely. Earlier, I used to sit down to eat my food, and the stray dogs would eat from my plate. I remember my problems vividly. Insects would sit on my food, and I would eat them without knowing. What should I say? I want to bless the doctor's soul. May God bless his children, and may his work prosper. I will never forget the doctor.
For more than 3.5 decades, not only was Dr. Ruit restoring eyesight for the poor, but he was restoring hopes and lives as well. He aims to transfer his cost-effective method to the furthest parts on Earth to give each human being the right to see the beauty of life.
I get tremendous inspiration from the patients that I treat, and such as there was a lady, let's say, she was blind when she conceived her child, and when you do the surgery, and she starts to see the world, and most importantly, she sees the child that she has never seen. And if you can get a sentiment like that with the work that I do, and what more inspiration that you look for. Secondly, I look for my inspiration to my family, my wife and children, and third, the wonderful team that I have. And these are, I really feel that these are the best in the world.